So I think one of the earlier questions was, for prehab, that it's sports specific. Now as a triathlete, and you got 3 sports to cover, question for, so what should we consider in our prehab considerations prior to starting, whatever, 3-6 months of training for a race?
Right, so swimming component, right? You're going to be using your shoulders a lot. And so what you have to think about is not only just like general maintenance on the rotator cuff for the shoulder, but what's your mobility like of that shoulder too as well, right? You can't get up into this position, something's blocking you. How can you try and release that on your own, or what can you do? But, I've started to focus more on this little spot up here in the upper T-spine, upper thoracic spine, right? And the neck's important in that lower neck too, but there's this little spot here that doesn't move on most people because they're all sitting here like this whole time, right? And so then we go in this position and our shoulders are already rounded forward, and then we get this position of impingement that starts to happen. But this little spot, this upper T-spine, is easy to kind of mobilize. It's easy to kind of get to move. And then you have to think about that if you're sitting here all day long for 8 hours and then you go swim, you're going to be swimming in this weaker position too as well, right? So you have to take care of your shoulders. The biking, again, you're going to crank your neck, you're going to be putting pressure on your lower back, and you just got to see what those 2 areas are looking like, right? And then in the running component too, you just got to take care of, well, for runners, everyone needs to have really good ankle mobility. They're finding that that's a huge component too as well, and no one really focuses on their calves very much because it hurts, and so they don't want to, and so they focus on everything else. But you need to kind of break down those 3, movement patterns and determine like what's a quick and easy for my shoulder. How do I make sure that I've got that full range of motion? How am I working on my pec because I've been sitting here, right? And what does my low back look like, right? The hinge is super important, right? Versus this rounding. And so when we're in this flex position all day, we lose our hinge. And if we can hinge, then that saves our lower back. And then for the lower, same thing, ankle mobility helps everything. So look at your sport and then go on YouTube. Everything's there. But,
I want to add too, if you're training consistently already, you are like light years ahead. And that can be considered your prehab. If you're just consistently training, you're setting the stage for the success in your sport already. And that might ebb and flow throughout the year. So say your training ends and come wintertime, now you're kind of down in your volume. That's when you can maybe ramp up gains and prehab. Like, get into a gym and do some squats or something, or do some banded exercises. But it might ebb and flow throughout the year. But I think consistency of training, especially for triathletes, that is like so valuable.
Yeah, you have 3 times as much stuff to do.
Yeah.
So much. It's a full body thing, right? Like a cyclist doesn't really have to worry about their shoulder range of motion if they don't for performance. It's great for their body and stuff like that, but for performance, it's not going to help them too much, right? But if you're swimming, you got to have that range of motion, that mobility through there. So you've got to that's when prehab is so much more important to you. Because a cyclist that's down there for hours, they're going to have a ton of sort of rounding and sort of hip flexor tightness, where then you got to get up and run off of that too. So you got to do more. It's quite different, right? So you have to be a little bit more refined on your prehab.
Nikki. So when it comes to rehab from an injury or from a surgery, usually there's a certain amount of times a patient comes in, weekly or monthly or whatever. With prehab, what do you recommend? And I know it's very individualistic, so this is kind of a tough one, but do you recommend a patient coming in once every 6 months to kind of have a check-in and see if they're doing their mobility exercises? Or is it something that you kind of just go off of, like, call me if you feel like you're not getting the progress that you should be? Like, how would you kind of go about that? I mean, do you just kind of like say, hey, every 6 months, or do you say it's and see how you're feeling?
Well, it totally depends on the patient
Right.
and what stage they came in
Right.
with prehab, right? So if a patient came in and they've got a lot of stuff going with the kinetic chain, we have to fix a lot of stuff, and they had pain or something else with training, then we might see them a little bit more frequently in the beginning, and then try to taper off. right? And I know that, like working with endurance athletes, I know that all you guys are really motivated, so I don't, unlike some normal patients, I don't have to push you guys to be doing things, right? And so after I kind of get rid of like the impairments that are going on with your system, then I'm going to really taper off and be like, okay, these are the things that I want you to focus on for the next 2 weeks or next month, right? Email me if you want and tell me how your training is going, and I'll give you some feedback. But at this stage, I want you to be at here, and at this stage, I want you to be here, right as well. I'll usually will talk about other things as well, like how your perception of your workout is going compared to your external load.
Right.
So I'll look at your internal load versus your external load, because sometimes that can affect how your workout is and whether I need to like decrease the amount of workout you need or increase. And then your readiness and your well-being as well, right? Because your well-being and your workload, those two graphs really affect each other as well. So I'll be checking in on those as well and making sure that, like by email or something, like making sure that you're doing fine, right? But once I get done with your impairments and stuff, I'll start to taper way down, and I'll be like, okay, these are the things I want you to hit, right? This is how I want you to feel after the workouts, and then just give me some feedback.
I think it depends on your goals too and how much support you're wanting, so which is a pretty individualistic thing. If you're kind of like, I want to be able to get out and run, in my kind of like mid-range capacity, and I just want to make sure that I'm taking care of my other systems and staying healthy as I go, then having a couple of visits up front to have somebody help kind of look at your movement, check out where your weaknesses may be, where you're strong, where your mobility could use some work and kind of help get you directed on a program. A couple of visits to just get that set and then kind of take it and run with it on your own may be great. If you're trying to operate, you're really trying to make gains and push kind of your upper limits, that space between like what your body is handling and that like the red line analogy, you're kind of like that ultimate capacity gets a little narrower, and you may want to have a little bit more support and guidance around like what you need to be doing. So yeah.
In the chiropractic world, we're on the sidelines with athletes, professional athletes, and stuff. They're coming to us all the time. Like, it's before games, it's after game, we're doing myofascial release on them, just like little things, because athletes are so fine-tuned in their bodies, they know exactly what's going on. They know when they don't have as much dorsiflexion in that right ankle, so they want someone to mobilize that and work it out. They come in quite a bit. And because it's not like they're doing all their other stuff, but with the prevention aspect, they understand that prevention, that performance aspect. So they use, I've got patients that come in, or athletes that come in before the races, after the races, and then tell them with the recovery, and then to prepare them, make sure everything's sort of perfectly in line and fluid and functioning well, they feel good, they feel mobile, and then they have a long race or something, and they're all tight, and they feel their right hip flexor, they'll come in just so we can release it and they can continue on. Yeah. So it really depends on what you're doing for sure.
Yes.
My question is, going back to how to pick a team. So the hardest part is picking a team. So we kind of heard everybody kind of what they're saying in their team approach and kind of what's happening. But if it was you, how would you pick your team, and how does your team communicate with each other about your own body? And to get to the prehab stage or to the stages that because if you see a massage therapist, they'll say, hey, your right shoulder's tight. You see a chiro, they go, no, your thoracic spine's tight, it's not your shoulder. If you see your physical therapist, say, hey, it's a proprioceptive response from your hips that's affecting you. So now as a non-healthcare provider, I don't know that stuff. How do I choose? And how do you get people to communicate with each other so you do have a team rather than just trying to pick and choose?
Such a good question.
That's why I created I say that because that's the frustration I had with that exact same thing is like, okay, I go get a massage or go to see the PT down the road or whoever your PT is, and the frustration of them going down there and then they come back, well, or I don't see him for like 4 weeks or 5 weeks of this injury because they saw a massage therapist that was working through their calf, thought their problem was down there, it wasn't actually in their shoulder, it was down their calf. And you didn't ever hear back from them, you got no notes back from them, that was frustrating, right? So for me, that's why I wanted my team, so I picked my team and my PT, my other chiropractor, my massage therapist, my acupuncturist, my functional med docs, so that I can walk down the hall and say, hey, look at this, can you check this out? Are you doing this? And then we sort of connect and talk in that. So when you're picking your team, always pick one person that has some good people with them so that they can help coordinate that person. You can't have 5 team members coordinating your plan. You need one person to coordinate your plan and then everybody else playing on that team, if that makes sense. Yeah, and your coaches sometimes are one of the best.
I was gonna
too.
say, I was like, I don't wanna throw all this under the bus, but a good coach makes a huge difference, huge difference.
Yeah, and in our Ravenna, we treat with the Brooks team, right? And their coach and their trainers, they're guiding all the care. And they're communicating with us. We have gymnasts that come here all the time. We're communicating with their coaches, what's going on, where we're at, what's happening, and they're telling us what they're seeing on the performance aspect of things as well. So that inner relationship and correspondence is so important. So really good point of like, just don't go pick out your people because they gotta communicate or else you're gonna get dizzy trying to.
I think too, you go to see somebody and you don't get good vibes about a different person, you know? Like, you can pick up on some of that.
Interview your providers,
Yeah.
right?
I mean, honestly, to add to that, sometimes I have no idea who to go see. Like, if something is hurting, I don't know if I should go see a chiropractor or a PT or an acupuncturist or I mean, yeah, I don't know, so.
Yeah, that's definitely something like with GridLink that we have noticed is like athletes, like we're over here, right? And we're like, who should we see,
Yeah.
right? And so Courtney helped coordinate with providers, a sports care guide to help start exploring those questions about who should you see, like in helping define, what the different disciplines do, but it still can leave you being like, who should I see, and when?
Yeah, it's really hard to, I know you said interview your providers. Sorry. We're going off the 15-minute rule. Who has time to interview a provider? Never mind that, you come in, you fill out 500 forms, and you sit down, what's wrong with you? Well, I'm here because I think I don't want something to be wrong with me. Okay, here's your plan, go run out, do this. You never had a chance to really sit down and establish that.
Even when I say interview providers, like I provide consults where you can just come in and talk to me, like see what I'm all about, and I'm pretty sure everyone here does the same thing, right? So you can just go, hey, can I talk to one of your providers, right? Can I just see if we're the right mesh? And if anyone's worth their salt, they're gonna be like, okay, sure. And I'll sit down and I'll talk to you for 10 to 15 minutes, right? Or whatnot, and we'll see if we mesh or not. We'll see if I can understand what's going on, and if you like me, you can go on, or you can move on to the different person. But as I said, like most providers will give you some time, so you can just talk to see if you like what their frame of thinking is, and if they are on your team, right? We're not going to make you fill out 100 forms and then do an eval on me. Like, we can do consults, right? Consult visits.
Well, it's funny because I think, and I don't know if it's intentional or not, but you probably need to do that before you're hurting, so you need to interview before you're hurting. Because you wait till you're ready, like, I don't care who you are.
Exactly.
Stop. I've been hurting for 6 months, and can I think of anything different?
All right, well, why don't we give our panelists a round of applause?